Welcome back, everyone, to Great Day, Louisiana. You know, May is Mental Health Awareness Month, and all throughout this month, we have been discussing different topics thanks to Avenues Recovery Center. Today, we want to talk about addiction. How does it happen, and how does it affect the body? I'm out here at the Metairie location to speak with a professional. Let's go learn a little bit more. All right, everyone, I have made it inside, and joining now for a very interesting conversation about addiction is Mr. Ricky Phillips. He's a doctor of nursing practice here at Avenues Recovery Center. Hello, my good sir.
Hello, Alan. Thank you for having me.
Thank you so much for joining us this morning. Right now, we're in your office, which is where you really see a lot of these patients who are honestly going through addiction and substance abuse right now. First, I want to talk to you as a medical professional. How do you explain addiction, and what's going on when somebody is addicted to something?
So addiction is a brain disorder. It's a treatable chronic medical condition. And two main parts of the brain are affected with addiction. The frontal part of the brain, which is where the decision making and the impulse control resides, and what's called the limbic system, which is the survival area of the brain, the very part of the brain, the primitive part of the brain. Normally, we get our rewards every day through things such as eating, drinking, seeking shelter, connection with others, taking care of our young. And the dopamine system, which is the pleasure hormone, is released every time we do those behaviors. So it's imprinted onto the brain and recorded as a memory, which prompts us to continue to do those things.
Because we're looking to feel happy.
We're looking to feel happy. So it promotes the survival. You know, it gives us a reason to do those things.
It really is an interesting conversation, and you know, since May is Mental Health Awareness Month, I want to talk a little bit about that connection between mental health and maybe substance abuse. Obviously, somebody's addicted to something when it comes to substance abuse. What is that connection? Because we were talking about how mental health can be a trigger for substance abuse.
Right. So often those are referred to as co-occurring disorders. Things such as anxiety, depression, post-traumatic stress. Those are the ones we most commonly see in addiction. And those are basically states of mind. Those can trigger the initial addiction, or addiction can worsen those co-occurring disorders. And it's important to realize that you know, at the end of the day, we're all looking to be happy. And when we find ourselves on the other side of happiness, we're going to go to great lengths to try and get that happiness back.
It's so true.
And there are plenty of useful ways to do that. You know, counseling, learning better life skills, coping mechanisms. But oftentimes people turn to a substance in an effort to find that relief. And unfortunately, those substances seem to work for a while, and then they don't. You know, so addiction can really be defined as not only a brain disease, but also as a response to human suffering.
And you know, for people who are watching this or who may know someone who is suffering with substance abuse, luckily here at Avenues, you all help those people try to get over that substance abuse. Talk to me a little bit about you all's medical program here. You all follow a level of care. What do you all do here medically?
So there's several levels of care, and those are set by ASAM, which is the American Society of Addiction Medicine. So when a person first comes into treatment and we have to get them off of the drug, that's the detox level of care. At that point in time, our primary focus is going to be safely getting them off of the drug and comfortably. Because some drugs, if they're not properly medically managed, can actually be fatal if the withdrawal is left alone. Alcohol being one of them, which is becoming more prevalent. The comfort, you know, we really need to address the comfort because everyone has a pain threshold. And if we allow the patient to exceed that pain threshold or that discomfort threshold from the withdrawal symptoms, there's a very good chance that they're going to leave. And if they leave, they're going to go right back to using. So our main focus on the detox phase is that comfort. You know, if we fail to provide that comfort and they leave, we failed that patient.
And you know, you all have a living facility here where you all do support groups and so many other things, which I think is awesome. But in the time we have left, Ricky, I want to ask you about that genetic component, right? If somebody's watching this who is saying, oh, my mom was addicted to meth and my dad had an alcohol problem, what's one tip you can offer them so they don't also fall into that category? So
genetics is a very real component of addiction. You know, the other parts of it being the environment, life experiences, and the circuitry of the brain. So if there's a family history of addiction or a family history of mental illness, you know, those are genes. You can't change your parents. You can't change those things that are given to you. So if a person has addiction in the family, and they're starting to experience symptoms of addiction, such as overusing medications, or if they're using medications, going through the prescription before it's due and seeking to buy them off the street, or they try and cut back and can't say no and find themselves using increasing amounts to get the same amount of feeling, then they're coming up on addiction.
And ask for help. I think if they do fall into that category, that they feel like they're doing one of those things you just mentioned, it's always good to ask for help and have a conversation like me and Ricky just had today. Thank you so much for joining us this morning.
Pleasure.
Ricky
My
Phillips,
pleasure.
everybody. And hey, if you feel like you have a substance abuse problem, Avenues can help you. They have 2 locations. This is the Metairie location, and they also have one in Covington. You're seeing the addresses on your screen right there. If you feel like you need help, they are taking insurance and they are accepting new patients right now. Call 504-608-5060 or visit them online at avenuesrecovery.com for more information. And stay right there, everybody. A lot more to come on Great Day when we come back.